I'm Dr. Truesdale. I'm a double board certified facial plastic surgeon and I work in Beverly Hills, California. Forget what you know. I'm here to show you the real. What is it really like to be a plastic surgeon? What is it really like to take someone back in time? To make them look different, to make them look prettier, or just to give them a boost of confidence with a subtle enhancement. I perform anything in the face. I mean, I do it all. Hair surgery, facelifts, nose surgery, anything that you can think of to make a person's face or neck look different, that's my jam. I'm pulling back the curtain on my practice to show you the real people, the real procedures, and the real results. This is about real life journeys, inspiring transformations, and the power of feeling confident in your own skin. We'll explore everything from subtle enhancements to life-changing transformations. I'm gonna share my story, the stories of my patients who've entrusted me with their faces and their dreams. Almost no one knows how stressful my job is, but the moment when someone sees their new reflection, that's why I do this. Because changing someone's face can change their whole life. This is beyond the surface. You'd be surprised how many patients don't tell their family members that they had any work done. And it's so funny to me because I can't imagine keeping anything like that for my loved ones. But for them, it's their prerogative. The other benefit is, a lot of times patients are having surgery done and I keep them looking natural. So when their family members see them, if they're not looking too closely, they'll just think, wow, you just look really good. You got a lot of sleep, huh? You look amazing. They're not thinking facelift, brow lift, fat transfer, blepharoplasty. They're thinking, wow, this is kind of a miraculous. Have you been going to church? Have you been eating right? Did you change your diet? Are you vegan? A lot of times they have no idea what's going on and the patients keep it a secret. It's wild. Good morning.
Good morning.
Hey guys, how are you?
Good.
Nice to meet you in person.
Good.
Welcome to the office. I'm excited. Let's talk about your face. Yeah. Today's patients are Sonia and Jose, and they are both 50 and 53 respectively. They are coming in as husband and wife. Very excited to take care of this family.
My name is Sonia. I am from the Central Coast. I have 2 children and I've been married to a wonderful man for 30 years.
Okay, so my name is Jose. I'm officially in my 50s. It's okay, I guess. It's okay to get older.
We got closer together in high school, so we're high school sweethearts.
We're so used to each other and we pretty much grew up together. We met when we were so little, so it feels natural.
All right, so we're here. So how are you feeling?
I'm nervous,
Nervous?
but happy.
We've spoken a little bit, but what's your overall goal? What do you want to achieve?
I just want a more youthful me, just a younger version.
Got you. I can do that. What have you tried in the past?
Some Botox, fillers.
Okay. How long was the last filler?
It's been about a year.
Okay. Let me grab a mirror. Let's look at your face together.
We have not shared this process with our children. I have mentioned it in the past. They think that I'm crazy. So I don't know how they will react. They will accept us either way, but it will be shocking to them that we decided to do this.
Is there one thing that bothers you, or should we talk about the entire canvas?
The entire.
Okay, let's talk. So I'll just go through briefly what we see. So we can see that the eyebrow has come down, so we want to bring this up. When we bring this up, we also want to take care of a little bit of that extra skin that's still hanging there and a little bit of that fat that's pooching out. The lower eyelid, we can tighten up this skin. You can see that effect there. That's the skin pinch. We are going to take out a little bit of the fullness in the cheek, that buccal fat, and we're going to lift up the face. So all of that jowl and fallen cheek, it's coming back up. We are also going to consider doing that lip lift, which is just going to be super pretty. Open your mouth gently. So right now, if you just gently open, just open this. There you go. You see no teeth, but when we bring that up, it just looks really pretty. And then all of this is going to go bye-bye. Yeah, will go away. So this is going to come up like that. So it's going to be really, really pretty.
As I was aging, I thought that I needed a little pick-me-up just to go along with my personality. I like to be active. My husband and I both like to be fit. So I feel like the face needs to go with the body. And that's why I decided to do this.
One of my concerns is to make sure that, you know, I am who I am, right? It's not gonna change me much. And, you know, I don't see that a lot of males do this.
Right.
So, you know.
And the reason why you don't see a lot is a lot of times when we do them, they don't necessarily want to be posted. So I actually have a few I can show you. I have several that I can show you. But the other reason why is a male facelift is actually a little harder to do than a female facelift, because if it's not executed perfectly, the face can actually look a little bit more feminized and more like a woman's face. Also, we bleed more. And so complications in terms of the hematoma thing, which is the most common complication of a facelift, it can happen a little bit more because all of our skin here that, you know, has the bearded skin, all of that sends blood to the skin. And so our anatomy is usually bigger, our blood vessels are usually bigger, and we have a little bit more blood flow to the skin. So if a facelift is done in the wrong way, right, see how that just kind of it makes a like windswept? That is not going to happen.
A lot of feelings, mixed feelings. I'm excited, nervous at the same time. I am who I am. I've been myself. I mean, I think I have personality, and my only fear is that by doing this, my personality might change a little bit. I don't know. But overall, I feel excited, you know, having to, I think a refresher of me, you know. I don't want to go back in time 40 years, but you know, it helps to get that refresher.
So my goal, if you look in the mirror with your face, is to take away just the heaviness.
Right.
So everything comes up vertically and naturally. So something along the line of this. Not too much. The jawline is going to be more etched out like that. But I don't want to. Right. Like this is too much. That's not good at all. And we're not touching your eyes. So not touching your eyes really keeps your identity preserved. Okay. So the eyes that you love, they'll be there. They're there. Yeah.
Okay.
So yeah. Good. Perfect. All right, beautiful people. I know you guys see all these comments and I don't have time to answer all of them, but I want to show you, I am reading them. And so I wanted to pick a few of these comments and actually answer them. So we're going to do a special segment where I'm answering your questions. So we have a question here at Rose Dixon 2961. I want to get some work done to my face, but I'm in Arkansas. What can I do? Well, you can come out and see me. We usually start the process with a virtual consultation, just like you would if you were here in Los Angeles. You come out to LA, we do your surgery, and then you go back to Arkansas, younger and a little bit more refreshed. Our second question, at what age is too old for a facelift or rejuvenation? So I don't believe in ageism, but I do believe facelifts and all plastic surgery should be done safely. So I don't put an age limit on the young side or the old side. In fact, I've done facelifts in 33-year-olds and facelifts in 88-year-olds and everything in between. As long as you are understanding the risks, the benefits, and you are healthy, we can go ahead and proceed with surgery. You have to be informed, you have to make your own decision. And it's really just about, at the upper age limits, it's really just about, are you safe and healthy enough to have surgery? So we have a question from @NotTodaySatan_7. Do you treat Caucasian women with hair loss? Of course, I treat everyone. So whether or not you're black, brown, you know, blue, green, I will treat you. And if you have hair loss, I will treat you. So yes, we treat Caucasian hair loss as well as African American and everything in between. If you have a head of hair and you've lost it, come see us. All right, our next question. So this is @Marina Huck D5G. So for the procedure you did on deep plane facelift, does she need drainage tubes after the surgery? Because I saw another video and where the patient flew back home in a week. You mentioned that she didn't need to stay longer. So great question. So how do I treat tubes? So I would say 60 to 80% of my patients who have facelifts get at least some level of drainage tube for the first, 1 to 3 days. 95% of the patients get it taken out in 1 to 3 days. I would say the only exception are men. Those usually stay in for about a week, and then they come out, and then the patient can fly home. So even if you do have a drain, which really just depends on how oozy you are during surgery, then you may or may not have a drain, but it always is coming out in that first week of surgery. All right, so we had 2 high school sweethearts, literally have been together for 30 plus years, who decided to take a big journey and trust me with their faces, right? A male and a woman, a husband and a wife, 2 surgeries day after day. I mean, they're couple goals, right? They are in their 50s and they look like they're in their 30s. They live healthy lifestyles, and it wasn't an easy road, but they were there for each other. Hello, guys. Hello. Welcome back to the office. Good to see you. So, tell me about your new lives.
We're still going through the journey.
You are definitely still going through the journey. You finally told your kids?
Not the whole story.
You didn't tell your kids? Oh my god.
Half of the story. They still only know half of the story.
So wait, what half of the story do they know?
I know we did our neck.
Neck, so they don't know it. They're starting. They're seeing it, so they just don't want to ask.
Right. Well, with you, I mean, most of the change we see in the neck, right?
Yes.
Your face, you do have less laxity in your face, but most of the changes that we're seeing is in the neck. Whereas for you, it's like, it's hard to miss, the neck, the lip.
Yeah.
I like the lip.
The eyes, right? You're still swollen too.
Yes.
But, it's more of a, the thing is with the lip, you can't really see the scar. That's the thing.
Our kids didn't know exactly what we had done. They obviously thought we were crazy. We didn't need anything. They thought that we looked weird for a couple of days. My son is so funny. He kept on checking in on us and saying, how is my Barbie and how's my Ken? How are my plastic dolls? He's really cute. But they kept checking in on us, making sure we had dinner ready, if we need help with our pets. I think overall they're okay, they're happy.
Is in the areas that you were like, listen, I have a chubby face to begin with. It's here. It's the buccal kind of space, and I can kind of feel the firmness there. Maria's been updating me. You've been doing some massage, right?
Yes.
How often?
Twice a day.
Twice a day? You're doing it yourself?
Yes.
Let me see how you do it.
I do it this way. Well, first I do it this way, and down.
Is that the amount of pressure you're using?
Oh no, I just a little bit more. A little bit more pressure.
I don't want to mess up your makeup.
I know.
But I do want
to. I go this way and down, this way and down, and then this way and down.
That's the perfect direction. The only thing is the pressure. We might want to modify that. Your lower eyelids look really nice too.
Yeah. I try not to go so hard around the eyes or here
Sensitive
because
skin.
I don't know where the fat transfer was.
Well, at this point, that fat is going to be, it's there.
Whatever.
You're not going to.
I don't want to move it too hard.
It won't move. It's not like filler. So
Okay.
it integrates into the tissue and it scars into place, and then the new blood supply grows into the. So it's not like filler where it migrates.
Okay.
Where it is where it's going to be. But also the skin, because you remember the extra crepey skin, that's gone now too. You don't have to worry about that like coming back because you're rubbing it.
Okay.
Your under eyes actually look perfect. That's not really where you're holding on to the swelling. It's like right here.
Right here.
Right here. Your neck is pristine for the gods. Your lip is so pretty. So Sonia looks absolutely wonderful. And it's so funny because I see it, right? Because I see people at different time points. But sometimes when people come back to my office, they know they look better, but they kind of forgot what they used to look like. So a lot of times I'll have one of the office staff get their photos and I'll have them put them together before I even walk in the room. And I do this for ammunition because when they tell me, hey doc, I don't look that different, or maybe I don't see it, or I think I look the same, I say, well, here's the proof. Look at you. Remember? Do you remember this person? Do you remember what they used to look like? And then they're like, oh my God, I can't believe I used to look like that.
I think it's a great thing, and I think everyone deserves, if they want to do it, go ahead and do it. Especially with men. I think a lot of men feel like, why should I do it? I think trying to be more refreshed, trying to not look tired, just look refreshed. I think it's a great thing, and I am absolutely going to recommend it. And to me, again, the first week is toughest. From there on, it's great.
I think plastic surgery is good for everybody if you're ready. It's not for everybody, but it definitely gives you a boost of confidence. And if you're ready, I'd say do it.
And so it really makes me reflect, and it's really goals for me, because my whole thing about plastic surgery is connecting people, making people feel younger. And so now that they look younger, even though they're already high school sweethearts, and then those memories of seeing each other all those years, they can enjoy their youthful faces together for many, many more years to come. And I help kind of extend that. So I'm really excited. It really just goes to show you that, being together, makes you go so much further than going alone. If you want to go fast, go alone. But if you want to go far, go together. On the next episode of Beyond the Surface.
Yeah, so I'm here today to do a surgery with Dr. Truesdale because I was unfortunately assaulted in New York, where I reside.
Season 2 is coming to an end.